Welcome back to the Pharmacology Vault. Today, we're going to take a journey inside your own chest to watch one of the most precise and reliable machines in nature, your heart, at work. In less than a second, this muscular pump performs an incredibly choreographed sequence of electrical sparks, mechanical contractions, and valve movements that ensure every cell in your body gets oxygen and nutrients. This is the cardiac cycle, and by the end of this lesson, you'll understand not just the what, but also the why behind each phase, with ECG links, heart-sound correlations, and key clinical insights. The cardiac cycle is the full sequence of events that happens in one heartbeat. It has two main components: systole, contraction and ejection of blood; diastole, relaxation and filling of chambers. Duration. In a healthy adult at rest, it lasts about 0.8 seconds, broken into 0.3 seconds systole and 0.5 seconds diastole. Purpose. To ensure continuous circulation. Right side sends oxygen-poor blood to the lungs. Left side sends oxygen-rich blood to the entire body. Key phases: wheel cover, atrial systole, the final topping up of ventricular volume. Ventricular systole, with isovolumetric contraction, pressure buildup, and ejection, blood outflow. Ventricular diastole, with isovolumetric relaxation and filling. Atrial systole, the primer pump. Imagine your ventricles as cups that are already 70 to 80% full. Atrial systole is that last pour to fill them to the brim. Timing. Occurs at the end of ventricular diastole, just before the ventricles contract. Action. Atria contract, pushing the last 20 to 30% of blood into the ventricles. This is called the atrial kick, and it's especially important when heart rate increases, because diastolic filling time shortens. Valves. AV valves, tricuspid and mitral, open to allow blood into ventricles. Semilunar valves, pulmonary and aortic, closed to prevent backflow from arteries. Electrical trigger. The P wave on ECG, atrial depolarization. Purpose. Optimizes ventricular filling for maximum stroke volume. Clinical connection. In atrial fibrillation, this phase is lost, which can reduce cardiac output, especially in elderly patients or those with stiff ventricles. Ventricular systole, isovolumetric contraction. Here's where the main pump gears up. Timing. Begins immediately after atrial systole ends. Action. Ventricles contract sharply, causing pressure inside to rise quickly. Valves. AV valves snap closed, producing the first heart sound, S1, or lub. Semilunar valves remain closed for now. Purpose. This phase is all about building pressure high enough to overcome the pressure in the aorta and pulmonary artery. Electrical event. QRS complex on ECG, ventricular depolarization. Why isovolumetric? Because all valves are closed, so the volume of blood in the ventricles doesn't change yet. The muscle is contracting, but blood is trapped until the pressure is high enough to open the semilunar valves. Analogy. It's like pressing on a syringe with the nozzle blocked. You're building force before release. Ventricular systole, ejection phase. This is the big payoff. The blood leaves the ventricles. Trigger. Once ventricular pressure exceeds pressure in the arteries, the semilunar valves open. Action. Blood is forcefully ejected. Right ventricle, right pointing arrow, pulmonary artery, right pointing arrow, lungs. Left ventricle, right pointing arrow, aorta, right pointing arrow, body. Valves. Semilunar valves open, AV valves stay closed. Endpoint. When ventricular pressure drops below arterial pressure, semilunar valves snap shut, giving the second heart sound, S2, or dub. Duration. Shorter than diastole but the most dramatic in terms of blood movement. Clinical connection. Narrowed semilunar valves, stenosis, prolong this phase. Incompetent valves, regurgitation, reduce efficiency. Ventricular diastole, relaxation and filling. Now the heart rests, but not idly. Step 1: isovolumetric relaxation. All valves are closed. Ventricular muscle relaxes, pressure drops rapidly. No volume change yet, hence, isovolumetric. Corresponds with the T wave on ECG, ventricular repolarization. Step 2: ventricular filling. Once ventricular pressure falls below atrial pressure, AV valves open. Blood flows in passively, first rapidly, then slows down, diastasis. The cycle is completed by the next atrial systole. Purpose. refills ventricles for the next beat, ensuring a consistent stroke volume. Clinical note: poor ventricular relaxation, diastolic dysfunction, impairs this phase and can cause heart failure symptoms even with normal pumping strength. And there you have it, the phases of the cardiac cycle: atria topping off the ventricles, ventricles building pressure, blood ejection, relaxation and refilling, all of it happening in less than 1 second, over and over, about 100,000 times a day. The more you understand these phases, the easier it becomes to connect ECG readings, heart sounds, and clinical conditions in cardiology. If you found this breakdown helpful, like this video, subscribe, and hit the bell so you never miss a beat from the Pharmacology Vault, where we make complex physiology simple, clear, and exam ready.